Hi everyone, my name is Taylor Arndt, and today I'm going to be talking about childhood cataracts. Childhood cataracts is also known as congenital cataracts. That means that it develops before birth or very shortly after. So the crystalline lens is the part of the eye that is affected, and this sits right behind the pupil. It's responsible for refracting light to focus on the retina. This disease is characterized by a cloudiness of the lens and can disrupt the normal eye development. Cataracts can also lead to other problems like amblyopia, which is a lazy eye. It can result in retinal detachment, which is when the retina separates from the blood vessels that provide oxygen and nutrients for the eye. So as you can assume, that is not a very good consequence. You can get strabismus, which is when the eye, both of the eyes don't align properly when trying to focus on an object. And you can also get glaucoma, which is damage to the optic nerve. To diagnose childhood cataracts, the red reflex test can be done at birth. This is an exam that measures the size and position of the visual axis. A full ophthalmology exam is also needed to diagnose childhood cataracts. This involves measuring the intraocular pressure of the eye and also an ultrasound of the posterior pole. So they can also do surgery, and it's better to have surgery early. Typically, they'll remove the cataract a couple weeks after birth if they catch it that soon, and then they will replace the lens after a year or so. But surgery is really just the start of treatment, because after that, kids are going to have to learn to adjust, and they're probably going to have to wear contacts or glasses for the rest of their life. So there are really over 100 genes that are associated with this disease, but obviously we really don't have enough time to go over all of them today. So I'm just going to go over the ones that I found to be the most common or that I found the most information on. So these genes are going to include the genes that encode crystalline, epithelial receptor protein, gap junction protein, and major intrinsic protein. So crystalline is going to be the first protein that I cover, and it is coded for by a couple genes, which include alpha crystalline, beta crystalline, and gamma crystalline. So the function of these proteins is to prevent heat and stress-induced protein aggregation. There are multiple mutations of these genes that can affect the crystalline production that they have found, which includes nonsense mutation, null mutation, and missense mutation. The effect this mutation has on the eye is a decreased protein solubility, which causes the formation of the cataract, and this gene is inherited as autosomal dominant. So the next protein that we're going to cover is the epithelial cell receptor protein, encoded by the gene EHPA2. So this is a transmembrane tyrosine kinase receptor, and it is responsible for cellular adhesion and cellular repulsion. This gene usually is characterized by a heterozygous missense mutation, and the effects that can have are reduced structural stability, decreased cell communication, and unusual protein folding. So the mode of inheritance they have found to be both autosomal recessive and autosomal dominant. The two gap junction proteins that we're going to go over today are encoded by the genes GJA3 and GJA8. So GJA3 encodes for connexin 46, which is a gap junction protein, and GJA8 encodes for connexin 50. These are both responsible for lens cell homeostasis and can be characterized by a missense mutation, which would cause cataracts. The effects of this mutation, if GJA3 is affected or mutated, you'll only get cataracts, but if GJA8 is affected, they have found that in half the patients, they also produce microcornea as well as cataracts. The mode of inheritance for this gene is autosomal dominant. So there is a major intrinsic protein that is encoded for by the gene AQPO, which is responsible for coding aquaporin, and this is a water channel that helps nourish central fiber cells. Aquaporin is responsible for maintaining transparency and homeostasis in the eye, and this mutation can be categorized by various deletions in the gene. So the effects of an aquaporin mutation are reduced water permeability, which causes the formation of a cataract, and it is inherited autosomal dominantly. So because congenital cataracts is a genetic disorder, there's not a lot you can do to prevent it. However, there are some things you can do to slow the progression. They recommend eating a colorful diet, so fruits and vegetables. These have antioxidant, vitamins, and phytochemicals to help nourish the eye. And then they recommend grains, staying away from greasy processed foods, and also eating fish that have omega-3 fatty acids. Alright, so Harper is a little girl whose story I read about on the CDC website, and unfortunately her life got off to a little bit of a rocky start because when she was 10 days old, her mom had noticed a cloudy spot on her eye and took her into the doctor. And then by the time she was 6 weeks old, she had already had surgery to remove the cataract and the lens from her eye. When she was 8 weeks old, she started wearing contact lens and an eye patch. And then when she was 1 year old, she developed an infection and was unfortunately diagnosed with glaucoma, which caused her to have 3 more surgeries. However, today she's thriving, she's adapting to her condition, and her and her family are very thankful for the early intervention to save her eyesight. This is just a little bit of a story to let you know that if you have cataracts or childhood cataracts, you're not completely doomed and your eyesight is not, or could be saved and not gone forever. Alright, that is it. Thank you guys for watching, and if you have any questions, you can just send me a message on Canvas. Thank you.